Good afternoon, ladies and gentlemen. My name is Dr. Lim Se Guan. I'm the consultant ear, nose, and throat head and neck surgeon at Lo Guan Lai Specialist Center, where I've been practicing for almost 30 years. Today, I'll be talking on patients' experience life beyond hearing aid. This is basically to share with you our experience in doing cochlear implant, which we have done since 2005. So I would like to share screen so that you can see what the presentation is all about. So I'm going to share the screen so that you can see my slide. And this is the first slide. The title of the talk will be Patients Experience Life Beyond Hearing Aid. As I mentioned, this is mainly to share our experience in doing cochlear implant in those patients who are not able to benefit from all other aids, hearing aid, or even very high power hearing aid. So eventually they need to undergo surgery called cochlear implant, where we implanted a microchip or a cochlear implant into the inner ear to aid them. And this group of patients are usually sensory neural deafness patients. So the next slide that I'm going to show you will be on the development of cochlear implant. Cochlear implant was first approved by the FDA in the United States in the year 1985 for adult with postlingual deafness. And the implantation was done in Malaysia not long after that. And for children, it was only approved in 1990. And over the years, the number of cochlear implants increased dramatically, especially in the pediatric population. This is because with the advent of early detection and also intervention in this group of patients, where we actually do screening. We actually do screening before the patient are discharged. That means upon what you call birth, before they are discharged from the postnatal ward, hearing screening are done, and we are able to detect babies who are hearing impaired and subsequently follow up with them. And therefore, we are able to detect very early and thereby intervene with the hearing loss. And this increased the awareness. And also this, we also spread the awareness on the early implantation. To implant on children, we have to implant as early as possible for the best benefit. In terms of speech development, if we implant them before 1 year old, most of them are able to hear normally and also to learn speech, to learn language normally. The recent development of cochlear implantation, it varies greatly among pediatric and adult. Of course, the bulk of our implant are in children. And in adult, there are a lot of cases where we can implant, especially, those elderly where their hearing loss due to old age and degeneration. They could have benefited, but somehow only a small group are implanted. Now, the cochlear implant done in Lo Guan Lai Hospital was first done in 2005. To date, we have done 148 surgery, and majority are children. I think almost like 90.5% of our implantees are children, and only 9.5% are adult. The reason for this low cochlear implant utilization among adults are the cost of the device is very expensive, to implant. And also the surgery is quite tedious and complicated. And also most insurance doesn't reimburse. So that's why due to the high cost and also lack of insurance reimbursement, we have very low CI implantation among adults. And also most adults, when they are deaf, they are usually quite old. And then when they ask them to implant, they say, I'm already old. So there's no need to implant. And also because of the uncertainty, because as in all implant, cochlear implant procedure, we cannot predict the outcome, whether it will be perfect or not. So the uncertainty of outcome also put away a lot of adults. And also partly also the awareness about the benefit of cochlear implant among adults is quite low in Malaysia. But of course, in developed countries like Australia, UK, their implant among adults are quite high. So in order to promote implant in adults, I think these are the few factors that need to be looked into. Now the indication for transitioning. Transitioning means when do we do cochlear implant, especially for adults. So in this group of patients, as they grow older, their hearing start to deteriorate due to old age, and some of them will start wearing hearing aid. When you wear hearing aid, they are able to hear. But then as time goes by, more what you call hair cells in the cochlea start to degenerate, and the hearing aid will not be of benefit after some time. So this leads to progression of hearing loss. And there comes a time where the hearing aid will not benefit at all. So if you look at the hearing aid, it's actually amplifier or a loudspeaker. So you amplify the sound and then transmit the sound into the middle ear via the tympanic membrane and the three ossicles, and then the sound is then transmitted to the cochlea. So in the cochlea, the nerve got to be intact for this amplified sound to be heard by this patient. But if the nerve in the cochlea is already completely degenerated or severely degenerated, no matter how much amplification or how powerful the hearing aid is, it will not benefit. That's where hearing aid comes in. So, of course, for adult, this is to create awareness for cochlear implant in adult. When an adult comes in severely deaf, and then we will do a hearing assessment, and then we will confirm that this is due to severe sensory neural deafness as compared to conductive hearing loss. Conductive hearing loss, you can do hearing aid. Whereas I say the hearing aid is actually an amplifier or loudspeaker. So if it is, the hearing loss is due to conduction, you amplify the sound very loud, you can bypass the blockage and then transmit the sound to the intact cochlea, then they are able to hear. But if they are sensory neural deafness, you can't, no matter how powerful the hearing aid is. So having done the hearing test, confirming that this is due to sensory neural deafness, we will do a CT scan to assess the cochlea, because you need a normal cochlea or at least a non-calcified cochlea in order for the cochlear implant to be performed, because we got to track in the electrodes of the cochlear implant into the cochlea. So the cochlea got to be normal or at least non-calcified. And MRI scan to look into the what you call the auditory nerve. Auditory nerve is important. It must be present because before cochlear implant can be done. I always use the example, it's just like your house, the bulb and the switch. If the switch and the bulb is not linked by an electrical wire, no matter how how you do, it will not be successful. So same thing here, the cochlea must be linked to the brain via the auditory nerve. In the absence of this nerve, you cannot proceed with cochlear implant. So that is two imaging that we need before for the pre-surgical assessment. Now, of course, we will also send for speech evaluation. Our speech therapists and our audiologists will look into it and counsel the patient pre-surgical and also post-surgical. Then, having done all this, we will proceed with the surgical procedure itself. This is usually done under general anesthesia, and the surgery takes about 2 hours per ear. And if sometimes we are lucky and anatomy is all normal, we can complete it in 1 hour. So having performed the surgery, after about 3 to 4 weeks, we will switch on. Switch on means having implanted the implantable part of the cochlear implant and waiting for the wound to heal. Once the wound have healed, then we will switch on. Switch on meaning I will send the patient to the audiologist. They will then attach the external component of the cochlear implant and switch it on. So when they switch it on, the external component will have a microphone and a processor. It will then process the speech and then transmit via a transmitter, which is on the outside, into the receiver, which is implanted inside the patient. And then from there, we will know how well the patient can hear. And the audiologist will then do mapping. Mapping means they will program what you call the cochlear implant suitable for this patient. And of course, after that, it's a long process with auditory and verbal therapy, where the patient have to be taught to hear and also to start to learn speech. So this is usually quite a long process. So the outcome for patients, hearing aid user, usually they will come to us and say that, oh, I have problem hearing in noisy environment. I cannot interact with people, you know, and the speech that people, I can't hear properly. And some of them actually go into depression. And because they get isolated and they are not able to communicate with society at large, so that could lead to severe depression. And a hearing aid doesn't make them feel better. So that's why cochlear implant, if it is done successfully, of course, the sound perception will be louder and clearer, both in a quiet and noisy environment. So the outcome, cochlear implant versus hearing aid, as I mentioned, hearing aid is basically a loudspeaker amplifier and a loudspeaker. So if you were to wear a hearing aid in a noisy environment, it's really, really noisy. Whereas a cochlear implant in a noisy environment is a lot better because it is not a loudspeaker. It is more like a electronic component that transmit electrical signal from the outside into the inside. So if you look at the improvement, those who wear hearing aid, there is about in a noisy environment, they have about 10% improvement. But whereas those with cochlear implant, their hearing improvement is almost like 72%. And of course, the outcome for those patients who have successful cochlear implant, they are able to hear well, interact well with society. It will reduce a lot of anxiety, and with a better understanding in speech and sound clarity, and also hearing in noisy environment is improved. they are able to interact very well and even carry on their life as usual. And this reduces a lot of cases, incidents of depression. And of course, for children, as they grow older, being able to hear and speak normally, their employment opportunity will also increase. Yeah. So I think this is all the outcomes of successful cochlear implant. So, and lastly, of course, there's sound awareness at level near to normal hearing. This is for those ideal, if their cochlear implant is really successful, they are able to hear almost like a normal person. So I think with that, these are a few examples of my adult patient whom we have performed the surgery. And I remembered this patient on the right very well because he's able to, it was so successful and he able to resume his work, and he's a metalsmith, and he make a very nice bicycle for me, a metal bicycle for me. So I think with that, I end my short presentation, and if there is any questions that you want to ask, you can type at the chat box, and then I will try to answer any questions that you want. Okay, I think with that, I would like to conclude my talk. Thank you for your attention.